Mbale Regional Referral Hospital, which serves 16 districts across Bugisu, Bikedia, and Sebei sub-regions, and also receives patients from Teso, has been facing a major challenge of having only one operating bed in its maternity theatre while serving a population of about 4.5 million people. The hospital carries out between 10 and 15 surgical operations on mothers daily, with over 600 deliveries recorded every month. However, due to the limited theatre space, mothers requiring emergency operations have often been forced to wait, a situation authorities say has sometimes resulted in poor outcomes for either the mother or the baby due to delays in intervention. With support from SEED Global Health Uganda in collaboration with Busitema University Faculty of Health Sciences, a new maternity theatre has been constructed and officially handed over to the hospital. The new facility is equipped with modern equipment and has 2 operating beds, doubling the hospital's surgical capacity. Speaking at the handover, Dr. Stephen Obo, the hospital director of Mbale Regional Referral Hospital, said the facility has long struggled with delays caused by having only one operating bed. He noted that some mothers arrive in critical condition and delays in assessing surgery have at times led to adverse outcomes.
So you can imagine when we had one theatre, having all those mothers being worked on in one theatre was causing a lot of delays. There are many times when you would have a mother in theatre, then another one with an emergency comes in, but you weren't able to intervene because the theatre was already being occupied and being used. So that would mean the mother would have to wait until that person in theatre had been worked on, and then space would be created.
Dr. Obo expressed optimism that the new theatre will greatly improve service delivery and enable faster response to obstetric emergencies. Dr. Richard Mogai, the Commissioner for Reproductive and Child Health at the Ministry of Health, said the explanation of the maternity theatre at Mbale Hospital was long overdue given the large population it serves.
Because Mbale is one of the regional referrals with the highest number of deliveries and cesarean sections, because it covers a wide area in terms of districts that it supervises.
He added that the new theatre will reduce waiting time for interventions and improve skills development for both health workers and medical students. Irene Atuhaire, the country director of SEED Global Health Uganda, said the organization aims to reduce maternal and newborn deaths by 2030. She noted that Uganda's maternal mortality rate currently stands at 189 deaths per 100,000 live births, with the Elgon region, according to figures, higher than the national average. She added that the organization will now focus on strengthening services at lower health facilities to reduce late referrals.
And we want to achieve 70 per 100,000 in 2030. And you can see the Elgon region is above the national statistics. So it's really an area of interest because of the statistics, and we want to see that we improve this.
Professor Paul Wako, the Vice-Chancellor of Busitema University, said the new theatre will enhance competence-based training for medical students and improve the quality of graduates. He noted that the university has previously been forced to limit the number of medical students due to inadequate training space, a challenge the new facility is expected to address.
But of course, it will also be used by the health workers in the Eastern region, the Mbale and the neighboring hospitals and health centers. We believe that this is a very important infrastructure and life-saving infrastructure.